everyone, I am Hannah Crystaljoy E. Bacus from BSN1 11H, and today I'll be demonstrating how to properly assess the abdomen. Now first, you have to review the client's previous reviews, medical records, and doctor's order sheet if available. Then you have to determine the scope of the assessment needed. You have to prepare the necessary equipment such as the stethoscope, a tape measure, gloves, and the client's medical record. Then you have to perform hand washing to deter the spread of microorganisms. Then, use gloves if deemed necessary. So good morning, ma'am. I am Hannah Crystaljoy E. Bacus, your student nurse for today. So may I see your wristband, please? Can you please state your complete name? Your birthday?
July 10, 2005.
Thank you. So, ma'am, how would you like me to call you?
Isang
Okay, Isab, I am going to assess your abdomen. So this is done for us to know if you have abnormalities that is present in your abdomen. So I'll be touching some of your parts of your body and exposed parts of your body, and there are some movements that you should follow as well. So is it okay with you?
yes.
Okay. So before anything else, do you have any clarification or questions? Okay. So prior to the conduct of this assessment, I have already closed the door and the curtain to ensure the patient's privacy and confidentiality. Okay, Isab, the data that I'll be getting from you is secured and safety with the medical doctors. So, okay, before we start, I encourage you to void first, so it will much be comfortable for you while you are doing the assessment, okay? Now, position the patient in a supine position. Okay, Isab, can you feel any pain in your abdomen? So note for any vascularities, note for any stray, assess for scars, lesions, and rashes. Note the history of scars and document its location by quadrant and reference lines. Then, inspect the umbilicus for its color, contour, and location. Inspecting now your abdomen. So while the client lies flat or supine on the bed, you have to sit beside the client, then look across the abdomen at a level slightly higher than the client's abdomen. So inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargement. So take all future measurements from the same location, especially for noted distension. Okay, ma'am, do not erase the mark until it is no longer needed, okay? So inspect the abdominal movement when the client breathes and also observe for peristaltic waves. So ma'am, can you please raise your head? And take inhale, exhale. Okay, thank you. So use the diaphragm of the stethoscope and make sure that it is warm before placing on the abdomen. So apply light pressure on simple rest the stethoscope if the abdomen is tender or painful. each quadrant for 5 minutes, a minimum of 1 minute per quadrant to confirm any absence of vowel sounds. Then note the intensity, pitch, frequency of the sound. Then, you have to auscultate for vascular sounds and use the bell of the stethoscope to listen for broods. Now to auscultate for venous hum, you have to listen for venous hum in the epigastric and umbilical areas. Now auscultate for friction rub over the liver and spleen. So place the diaphragm of the stethoscope over the right and left lower rib cage and listen for friction rub. Now percuss for tone. So with the percussion hand technique, lightly and symmetrically percuss all quadrants. So percussion may proceed clockwise or up and down over the abdomen. Now percuss the span or height of the liver by determining its lower and upper border. So determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. Then note the change from tympani to dullness and mark the area of dullness. Now to assess the descent of the liver, you have to locate the liver border of dullness. Okay, ma'am, can you please take deep breaths for me, please? Okay, again. Now percuss the upper border of the liver. So locate the upper right chest at the mid-clavicular line and percuss downward. So mark the point where the change from the upper chest or lung resonance until liver dullness is noted. So this is the upper border of the liver dullness. So then, after that, you have to measure the distance between the two marks. So this is the liver span. So you have to repeat the percussion of liver at the mid-sternal line. Percuss the spleen. So begin percussion on the posterior to the left mid-axillary line. Then, percuss downward. Note the change from the lung resonance to spleen dullness. Okay, ma'am, can you please turn this side? Perform a second method of percussion to determine the enlargement by asking the client to take a deep breath and start percussing on the left interspace at the anterior axillary line. Okay, ma'am, can you please take deep breaths for me? Now for blunt percussion on liver. So ask the patient to sit. Excuse me, ma'am, can you please sit down? Now place the left hand face against the lower right anterior rib cage. Then use the ulnar side of right hand face and strike the left hand and note for any tenderness upon percussion. Now let's proceed to the blunt percussion on kidneys. So place the left hand on the costovertebral angles, then repeat steps 44 to 45. So now test for abdominal distension or bulging flanks as it is. So percuss the flanks from the bed upward toward the umbilicus. Then note the change from dullness to tympany and mark this point. Then assist the client to turn onto the side. Then percuss the abdomen from the bed upward. Then mark the level where dullness changes to tympany. Okay, ma'am, can you please turn to the side? Okay, thank you. Next is to perform the fluid wave test. So position the client back in supine position, then cover the upper and lower body parts with a bed sheet, then leaving the abdomen exposed. Then note for any resistance or any deeper structures. After that, perform by manual palpation if resistance or deeper structures is felt. Then next, palpate for masses. So note for any masses and its size, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility. Next is to palpate the umbilicus and its surrounding. So note for any swelling, bulges, and masses. So next is to palpate the aorta. So use your thumb and first finger or use both your hands to palpate deeply, then assess for pulsation. Now palpate the liver. So stand at the client's right side, then place the left hand under the client's back at the level of the 11th and 12th ribs. Then lay right hand parallel to the right costal margin. Then ask the client to inhale, then compress upward and inward with with fingers. Then note for consistency and tenderness. Okay, ma'am, can you please inhale deeply? Okay. Next is palpate by hooking. So stand to the right side of the client's chest. Then curl or hook the fingers on both hands over the edge of the right costal margin. Then note for consistency and tenderness. Then ask the client to inhale and deeply again. Okay, ma'am, can you please inhale and exhale for me, please? Okay, again. Thank you. Now test for cholecystitis. So press your fingertips under the lower liver border at the right costal margin and ask the patient to inhale deeply. So note for right upper quadrant pain and tenderness. Okay, ma'am, can you please inhale, exhale deeply again? Okay, again. Okay, thank you. In palpating the spleen, ask the patient to turn on her right side. So, ma'am, can you please turn on your right side? Then palpate the spleen by moving it downward and forward. Then document the size in centimeters below the left costal margin. Then note for consistency and tenderness. So, in palpating the kidney, place your left hand on the right posterior flank and provide support. Then place your right hand on the right upper quadrant here, just below the costal margin at the midclavicular line. So, ma'am, can you please inhale and exhale for me and hold it for a second? So, gradually release the pressure of right hand. Then, repeat the steps for the left kidney. Okay, ma'am, can you please exhale and hold it for a second, please? Okay, thank you. Now let's perform the hypersensitivity test. Now stroke the abdomen with a sharp object or grasp a fold of your skin with your thumb and index finger. Then quickly let go. Then repeat step 102 several times along the abdominal wall. Then note for pain or exaggerated skin reaction. Now the test for Pessoa sign. So ask the patient to turn on her left side. Then can you tell me, ma'am, if you feel any pain? Okay, thank you. The test for the obturator sign. So hold and support the client's knee and ankle. So note for pain and reaction of the client. Do you feel any pain, ma'am? Test for appendicitis. So assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area and suddenly release pressure. Listen and watch the client's expression of pain. Okay, ma'am, do you feel any pain? Okay, no. Okay, ma'am, we are done with the assessment and I will summarize all the results to you. Upon inspection, your skin is uniform in color, so no rashes, no lesions, no scars, and your umbilicus is midline and inverted, which is pretty normal. So your abdomen is symmetrical, and upon auscultation of your bowel sounds while I was listening to your abdomen, the sounds are pretty normal also. And I hear no bruits or venous hum. Then, so I was measuring for your liver size on your liver span at the mid-clavicular line. I measured it at 7 centimeters. And while I was measuring for your liver span at the mid-sternal line, it is measured at 5 centimeters, which falls within the normal range. And also, upon percussion and palpation, there were no tenderness, no masses, no bulges, and no swelling. Then, overall, the assessment or your abdomen is pretty good. So, do you have any clarifications or questions? Okay, thank you. So, that is all about the assessment of the abdomen. Thank you.